All right. Well, welcome everyone. Looks like we have a good turnout today, and it's a good day to be here because we have some fabulous guest speakers, Holly Hayes and Katherine Johnson, and they're going to talk to you about a great project that's been going on. How many years, Holly?
Well, this needs assessment's just been in the last year.
Okay. Um, okay, so the last year, the needs assessment for the Live Well Kershaw project, and I'm going to turn it over to them.
All right, thanks. I'm Holly Hayes, so happy to be here, and I'm a research associate at the Core for Applied Research and Evaluation, and the principal investigator for Live Well Kershaw, which is really a 3-year initiative to really focus on enhancing population health of a community and working together with multiple partners to make it the healthiest county in the state of South Carolina.
And I'll go ahead and introduce myself. I'm Katherine Johnson. I also work for the Core for Applied Research and Evaluation. I'm a research associate, and I just finished my MPH in HSPM last year. So I was just taking this class last summer, and now I'm actually applying this work in the field. So I'm really excited to be here and share my experiences with all of you.
Good. And so what we're going to do, guys, is the textbook version of needs assessment may seem pretty, I don't know the word, pretty much you do these steps and these things happen.
Step by step,
So,
it goes
yeah,
like this.
we're going to tell you some methods, but we're also going to tell you a little bit about our frustrations or kind of like the real scoop, kind of behind the scenes. Catherine and I both like reality shows. We're going to give you a little bit of the reality of needs assessment. So our goal today is for you to kind of have a flavor of different methods you can do for a needs assessment, but also understand kind of the scope. So if someone approaches you to do a needs assessment, you'll kind of know some questions to ask and understand what's involved. Because if someone just says focus group, it can mean a lot more than just a focus group. So we hope to give you that. And then we really welcome questions, feedback from y'all, and we'll try to answer them. Yeah. All right. Well, with that, we'll get started. Okay.
For some reason, I've only found it really works with them now.
Okay, so really, I'm going to give you a very brief background, and then Catherine and I are going to tag team and talk about 4 different methods we use for our needs assessment. So we're in the next slide. So really, how this really happened was because of the Affordable Care Act, all nonprofit hospitals are required to do a community health needs assessment. So the Arnold School of Public Health 3 years ago did a needs assessment for Kershaw County. And for those of you who may not be familiar intimately with all 46 counties in the state, I can sing it if we need to later. But
there's a song.
There's a song. Abbeville, Aiken, Allen, Hale, Anderson, Bainbrook, Barnwell. So Kershaw County is a county that is adjacent to Richland, and it's about a 30-minute commute from downtown Columbia. And it's a very large county in geography. And so what happened is the nonprofit hospital in Kershaw County got purchased by Capella Healthcare with Medical University of South Carolina. And so now the hospital is a for-profit hospital. So because of the 3-year rule, they really were not required by any federal requirements to conduct a needs assessment, but the group really decided that they really needed to see have a new needs assessment conducted before they made decisions about where to invest millions of dollars that the Health Service District of Kershaw County had. So they came to us and they said, you know what, we really want a full snapshot, a state of the state of where things are in the county, and we want to define health broadly. So we're not just interested in chronic disease indicators, but we also want to know about transportation, other health factors. So the first thing we really did this needs assessment about a 6-month process. So the first step in our thing was probably typical, is just an environmental scan or data scan. So this is where we primarily used a lot of census data, used community commons, data from the health department to really kind of get a snapshot of all the data that's already been collected to really figure out where are they in rankings. With county health rankings, they rank 16 out of 46 counties right now for overall health, and then also just look at major issues. So for that, the key here, y'all, is to have good references. Make sure you have the most up-to-date data and then to be able to display the data in kind of tables. Kind of behind the scenes challenge we had was I had used the wrong data related to schools. And so when we gave our final presentation with the needs assessment, I shared that one of the schools was an underperforming school, and it was actually rated as excellent, had one of the highest rankings in the county. So I will tell you, and then the principal kind of nicely said, your data is wrong. And so I think the key for environmental scan data is you're going to have so much data available to you that you want to cross-reference it and validate that data with the right experts. So when I'm pulling data from the Department of Education related to the schools and what percent of the schools have a Medicaid population or what their score is, the key lesson learned from that is that we need, before I present data about education, I need to make sure that it's congruent with the current data. So that was a lesson learned from this. And so I think it's easy, you just have all these data tables, and you and I, like if we don't live there, it may not come out to us. But if you're presenting this data, those community residents take that very seriously.
Right. So what would you have done? I mean, what would you, like, who would you have checked with on that?
Yeah, so the issue here is I worked with a doctoral student, and I really just gave it to one person to do. So in retrospect, what we should have done is we should have had two different people work on the data scan and each cross-check the data tables to make sure we're not pulling one number off incorrectly, because a 52 and a 25 can be very differently. But also, once I have those tables completed, hey, here's the education tables, which it's in the document, y'all have that thick document, then send it to the superintendent and just say, Dr. Morgan, does this jive with the latest data you have, or do you have a newer, more current version of what we're looking at?
Yeah. So before you go to a public meeting,
correct.
Check within your system and check with a key stakeholder.
Right.
Yeah. So you avoid embarrassing yourself.
Right.
And
right. So the key from this, and now the reality version of this is, I then had a meeting with the principal, and we sent out a letter to everyone to correct it, because especially when you're talking about county level data, I mean, this data, when you're presenting, they really take it to heart, and people were talking about this at church the following day. And so we sent a letter and corrected it. And then since then, we've had great experiences. But I always share data first with the people really it's intended for before. So it's like you need to
That's a really good lesson learned. Yeah.
So
thanks for sharing.
No problem. No problem. So some of the things that we discovered from our data scan were that there were definite income disparities. There were about 16 zip codes for Kershaw County, and there was a definite pocket, especially on the border of Kershaw County, where folks are to median, $80,000 range, to the northern part of the county, where the median was around less than $20,000 a year.
Wow.
And so there were gross income disparities. A shocker to a lot of folks was that 25% of the residents of Kershaw County do not have any insurance. And so this was found out through the data scan. So the word on the street was because of the Affordable Care Act, health insurance enrollment was not an issue. But from the data scan, it became really clear that there was a gap. There was a gap. And so this was an area I was like, but with data scans, you're always dealing with data lags. So this was an area I definitely wanted to think about how could we delve deeper and talk and use focus group methods and other things to really figure out, like tease out what's going on. And then it was really evident through the data scan that there were a lot of food deserts in Kershaw County. So we did map that, and that's just meaning that there are a lot of areas where there's not a grocery store or a place for food, quickly accessible, and walkability in Kershaw County is a major issue. There are not a lot of sidewalks, and again, the disparity is it may be in a concentrated part of the county, but it's not spread out.
Like in Camden, there are sidewalks.
So it's not spread out. So we first just with this, remember this was just a 6-month process. So for the first part, I did the data scan. So I immediately sent it to our funder and said, here's part one, and now we're going to start part two, part three, and part four. I'll have to say, when they got part one, Catherine, they really didn't know what to do with it, and they just kind of said, thanks, that's nice. And then we kept moving on
So
to the
what
next
now?
round. Yeah.
So we'll get into that now. So our next step was the community survey. And what we did for that was we had paper versions of surveys, we had them translated into Spanish, and we also had an online version that was sent out. So our goal for this survey was to collect 1,000 responses from community members all throughout Kershaw County. So I put this on SurveyMonkey, and as you can see, we actually ended up with almost 1,200 responses from community residents. And we were able to be successful in reaching that number because we have, I would like to call them community champions throughout the community. We've already established a reputation with them. So we were able to have these surveys completed by using two of the largest employers for Kershaw County, which is the school district and the hospital. So they sent out mass emails, and then we had our own little personal community champion that really knows community members well. Like one of the greatest, highest levels of paper survey responses we got from a Jiffy Lube. She literally took paper surveys, and people, while they're waiting to get their oil changed, completed this survey. So that was really exciting for us. But the purpose of this survey was really to get at what individuals are thinking about their community and the health issues that they are personally facing. So we were able to gather information that way.
And Catherine, I'll just have to say, in our document has a copy of the survey
Oh,
if you
okay.
want it, because we kind of modified one from the health department.
Right.
But it wasn't a short survey.
It was pretty lengthy.
Yeah. So this was
Right.
like almost a 4-page survey. And I think, and she's going to go through the findings, but I think a key, y'all, is that you really always, I'm big on, you have to just state your aim. What are you trying to accomplish? So I think it was key for us to go into meetings and go to the Rotary Club or wherever we were presenting and saying, our goal is to collect 1,000 surveys. And they would be like, whoa.
How are you
And
going to do
every
that?
time, every email we sent, we said, dear, whatever, we're at 400 surveys. Our goal is 1,000 surveys. Help us reach that. So I think that was what made it so much more successful than the survey that happened 3 years prior in this same county, was setting a goal for a number and then also having key community members who are like complete champions, and they were going all over to get people to do surveys.
And I think we also ran the link to the survey in a local newspaper
We had
as
ads in
well.
the local paper.
So some of the key findings we found from that survey, some top issues were obviously obesity, followed by substance abuse and high blood pressure. And then we got to some of those root causes. You know, why do you think this is an issue for your fellow community members? And we were able to see the no health insurance as that we saw that aligned with the data scan. Followed by personal choices, accountability, and lack of healthy foods, going back to that food deserts, and just a lack of built environment.
And I just want to stop here for a second. So it's interesting, one of the top issues discovered was substance abuse. And when we looked at the data scan, the opioid epidemic didn't come up as an issue for Kershaw County. But you have to remember, a lot of the key data sources have like a 2 or 3 year lag. So this is kind of an area where you never want to rely completely on one data source, because, and you'll see this substance abuse keep coming up. So this is something that started to come up here first in the survey and some other methods, but it didn't come up in the data scan. But it's truly because this is, you know, you're hearing from residents real time
who are personally dealing with those issues. So our next technique, which also echoed some of the previous methods that we used, was we actually conducted 5 community focus groups. And we wanted to do 5 of these groups instead of just 1, is because Kershaw County is such a large region that if you just do one focus group in Camden that's, well designed, has sidewalks, might be the oasis of Kershaw County, you're not getting any of the insights from other community members that are located way out in extremely rural areas. So we did 5 focus groups, and we had about an average of 5 to 11 participants at each of these focus groups. And at each of these groups, we use the 5 whys technique. So if community members identified obesity as an issue, we would then ask them, why do you think obesity is an issue? Some might say, well, people are lazy. Then we would ask again, so why do you think people are lazy? We're really just asking 5 times why to get down to that root cause and see if there is somewhere in the system that these issues are occurring.
Yeah, I'll just point. Yeah, so here the nice thing about the 5 whys technique, and we can share this with you, but it was important for us because a lot of these residents, some people didn't even know each other. Some people at the focus groups did, but when we did this method, we always had people first answer the question individually on sticky notes to honor introverts and people, not just because Catherine says obesity, oh, now I have to think obesity. So we were able to kind of theme topics based on what people thought the needs were, and then have discussions. And it was absolutely amazing. Like, people don't even know each other, but there were such similarities in where people thought the 3 major issues were in the county. And so it was just real interesting because once we did the individual brains, private, individual, Catherine would then theme all these post-it notes, and then I would then lead a discussion about each thing. So I do think it was a really nice technique that worked, that allows somebody not to dominate just whatever their thing is.
So where did you do the 5 focus groups, and how did you recruit participants?
So I think we did one in Camden, Lugoff, Elgin,
and the North Central area.
Is there one in Bethune?
I did it at a church. We did it at church.
We did it at one of the church satellites for Livewell Kershaw.
And we also did one focus groups with octogenarians, those who are over 80, because the funder was really interested in knowing whether the county needs more assisted living. So we did one focus group just with those 80 and over to talk about
how did you recruit them?
So one way that we recruited was we tapped into some of the satellite locations that we are currently using for Livewell Kershaw to do some recruiting there, because the community health workers already know several people. But we also had, I believe, a grad assistant go out to the library, grocery stores,
Roses,
and pass out flyers.
Yeah, so we had flyers, and we gave people $30 compensation and a meal. But a lot of it was, we did the library. We got a lot of people actually at a Roses parking lot. And in small towns, Roses is kind of like what was formerly Kmart. And so just getting people to come that way, for different things. And Catherine's going to share maybe some of the findings with it, and then we'll go through the reality version of focus groups.
Well, because recruitment is 98% of the work.
So there were some issues with focus groups, but we'll talk about it after we go through the good stuff.
All right, here we go. Okay, so these are some photos from our actual focus groups that were conducted. And we had a pretty diverse crowd. I remember in one of our groups we had kind of the soccer mom type. Then we had one individual that was disabled and living off of disability. And then we had some that were living in Section 8 housing. So we had a very diverse group.
And their relationships with drug dealers. I mean, some of the focus groups got real interesting.
It was very interesting. But some of the top health problems that we identified from the focus groups were related to built environment. We've heard that one before. Increased cost of living, increased cost of health care, and then the root causes of health problems, lack of available community resources. Perhaps you may not have a park within 5 minutes of your home or somewhere safe you can exercise. And then again, the cost of health care and the increased cost of living.
And so the surprising thing here is, because we did 5 focus groups in a matter of 2 months, and these are in the evenings, and we're going through this. And our theory, or the theory of the funders, was that we had to do 5 different ones in geographies because they really thought that the issues that were going to be identified were going to be very different. So the issues of kind of an urban Camden are going to be very different than the town of Bethune, which is in the rural part of the county. And surprisingly or not surprisingly, every single group brought up cost of healthcare, lack of available community resources, really the need for safe lighting and recreation facilities for them to do things. So there was a lot of similarity, more similarity than I think anyone ever expected from these focus groups. Yeah.
Wow.
So the congruency of all the focus group data was really good. Yeah. Do you want to share some juicy quotes?
Oh, sure. Yes, so I wanted to share a couple of quotes that came out of our focus groups that I believe we included in the report as well. But one person says, I have a friend that has top-notch diabetes. He will go to the hospital because he cannot afford the medicine. Medicine, period, is expensive. So that gets at our increased cost of healthcare and the fact that most of these individuals cannot afford even their medications. And then in relation to healthy food choices and availability, one person said, you might not know how to make wholesome foods, like fast food restaurants are on the road, so it's easier to eat unhealthy.
So yeah, the focus groups were very beneficial at kind of getting at that the deeper sense. One of the things that's cost of healthcare is that maybe there's some pride with some residents. So if they didn't feel like they could pay for the healthcare, they weren't even going to go after it. So
Or
kind of
ask
this,
for help.
right. So it was very beneficial to kind of get deeper with this. Now, the other side of this, guys, is focus groups can be very difficult. And it's not that, I mean, we had our moderator guide, we had our approval for $30, all that stuff, but it's ensuring you're getting the right composition of your group. So you're just not getting people who are going to say what you want to say, but we truly wanted community members for this. And so it was difficult. I mean, I think I would go these evening times and we had no idea how many people would show up.
Right.
So you have
You don't
food
really
for,
know what
You
to
don't know
expect.
you have
until
food
you
for
show
15,
up.
and
Right,
you really
right.
don't know. So you can see in this bottom picture, there was an awesome turnout, but that was one of the champions asking the person who did her lawn to come. She asked the person who did her hair, and then she repeatedly would call them and remind them, like it was so important. So that's like that. But for some of this, it just takes a lot of persistence. And then I think 2 of our focus groups just got canceled because we didn't have enough turnout.
Right.
So I think the key is just to be persistent and keep moving. But just know that if you're going to agree to do a focus group with someone, what I would do is to say, well, what support do I have in that community? Who's going to help with that piece? Because facilitating a focus group is the easy part.
Yeah.
It's
Getting the people there is the
Right.
difficult
It is.
part.
No, that's not. I really think that's 9/10 of it.
right. So, but when you're talking to a funder, they're more apt to listen to these quotes from these focus groups, and they'll continually quote things, and they spend more time with that than they do the data scan that took you tens of hours.
Right.
So it's interesting. I think you have to somehow marry sometimes the data plus the narrative, but that makes it much richer. Yeah. So we're going to keep going. Okay, and so the last thing we did was key informant interviews. So our funder decided that it was important to kind of get some leaders' perspectives, because remember we've had the community survey, which everyone, and so they selected 7 quote key informants from the county that we would ask their perception about where they thought the funders should be headed and where they considered to be the needs. And for them, the key informants include someone from the health department, a mayor, a principal of one of the local schools, just some of those key players. And so basically what I did, we'll go to the next slide, is Catherine and I literally just had phone calls with these individuals. It didn't take long. And I think we gave them the questions ahead of time.
We did so that they could prepare.
Right. So we gave them the questions, and then from that, really, they just said there's a lack of access to healthcare resources. They said, years gone by, 4 or 5 years ago, there was this nice health resource center in the county. Health fairs were great. All these things were happening. And then when that building kind of closed, everything kind of dissipated. And they really thought that there wasn't a lot of prevention focus going on in the county. And it's interesting, some of the key informants really said that there needed to be this personal accountability. So I think one of the folks said, what can we do to make parents feel more accountable? And give an example of, maybe a child has this issue and the parent may not follow up with doctor's visits or stuff, and then the child may have to repeat a grade because they missed so much school or different things. So that became, so a quote for that was, how do you impart caring and responsibility? Helping people understand their roles and reducing or eliminating these barriers. And so it was really interesting with the key informants that they really thought there needed to be more focus on prevention education, which somewhat came out in the focus groups because people said, you just can't give me pinto beans. You got to teach me how to cook them the right way, or I'm just going to put lard in it. So that kind of they re-emphasized some of the things. But I think for the most part, for this, the key informant interview, I think at this point, I thought, we are at saturation because we're getting a lot of the same things over and over again with not a lot of differences in information. So I'll say just behind the scenes, key informant interviews are easy peasy. They're very easy to do.
To knock out.
We had our thing. We called, scheduled, I think 20-minute things. I think we did digitally record these, so if we had verbatim transcripts if needed to go back. Rev.com, REV.com is where we did all our transcriptions for the focus groups and key informant interviews. And it's wonderful. It's $1 a minute. And literally what you do is you just upload thing and it's just wonderful. So that was great. So really from all this, cost of healthcare, was a key thing that kept emerging. And then folks really thinking that there could be a lot more community health resources. And then the last was just personal choice about really even residents in the community survey. We all had an open-ended version, and people were very verbose about, how can we get people to change a lifestyle, or how can we get this paradigm to shift about lifestyle choices? And so it's interesting in the survey because you had some folks say, well, this is how you do it, and if people aren't doing it this way, they're kind of dumb, And so, and then you had this whole other cohort of survey respondents saying, we want to do better, but we just don't know how.
Right.
So you kind of see the dichotomy of education, just different things about this. So there's not like a right or wrong answer. It just shows the complexity of the county and where things are. All right, this is me. You can't remember. So y'all talk about depressing. So after we do this whole document, you have, if you ever want some reading the 68-page community health needs assessment, I then Catherine and I went and we presented to the board, and including the hospital CEO and the chief medical officer. And the chief medical officer nicely said this was the best needs assessment she'd seen in a long time.
The most comprehensive.
Most comprehensive. So that was nice to hear.
Yes.
And so then we're real pumped, and I gave the presentation, and y'all, these board members, and it wasn't this presentation because I'm talking to you about more methods, but I gave them pretty maps and issues, and they were just like, look completely overwhelmed, and just like, they didn't know what to do with it.
Right. Where do we go from here? We've been given all of this information. What is our role in using this information?
Right. So by this point, it's about 9 o'clock at night. So it's pretty late, and Catherine and I just go home. And we talked to the executive director, and I said, well, after a community health needs assessment, there's this thing called a community health improvement plan. So you take it from data to action,
Action.
which is where Catherine and I like to live. And this group hasn't moved to action, and that meeting happened probably 6 months ago.
Mm-hmm.
Okay,
That's
so
right.
so this is an example. So this is an example of a funder who had money they wanted to spend, and they had two people on their board who really see the value of needs assessment.
Right.
But where this board is, they're really focused on some other things right now, and buying some real estate, dealing with some other areas, and so they haven't moved forward with it. So I have actually pushed them a little bit. We need to do a dissemination plan with these results, because when you meet with the largest employers in
Right.
town, you get these community champions on board.
Mhm.
We all promised them that they would get these results. And that's very important, because I don't ever want to be, we don't want
You
to
don't
be
want to drain data from a community and not return anything back.
right. So that has not happened yet.
Right.
So now we're thinking we're going to do another kickoff for a renewal of Livable Kershaw, which is kind of this bigger effort in August. So we may do that, but the dissemination for this really has not happened, and so that's been bothersome.
Right.
And I think maybe in retrospect, when we started, I was real excited. Hey, I got this big contract for 6 months. Let's get it started. But we should have gone ahead and told them, community health needs assessment is just one part of the sequence, and that we need to say, well, the next sequence is this improvement plan, and then bolstering community groups. Because people think, well, it's a needs assessment. That's just checking a box. People need to think about what the end game is. So when you're working and doing, 2.0, 3.0, you're going to leapfrog Catherine. I think it's important for you to really figure out what's the purpose behind them asking for a needs assessment, because you might not need the Cadillac version. You might just need a Pinto version to get what they need to make those decisions. But if they do need that, you really need to think about, more importantly, the improvement plan. And then right now we're thinking, how can we make all this data accessible? So one good thing that's come from this is we realized after we did this comprehensive needs assessment that the chairman said, Holly, I still don't know where I'm supposed to spend my millions. He still didn't know where to spend his millions of dollars. And so we have since worked and now have an interactive map also to really show, like, we can map, where the mental health providers in the county, and dots will appear so he can see gaps, or where is this. So we've actually moved from the needs assessment now to more data to an interactive map to really bring stakeholders together to help make decisions. But unfortunately, this group is still stuck in the analysis paralysis. And we really, what I'd like to do is have some sense making sessions with the group to really make sense of this data and then move on. But at the end of the day, it's their thing. So it's been unfortunate because we're not the drivers, the funder is. So with that, we'll take questions. Or
Yes.
you have
Questions.
Okay. So to ask questions about behind the scenes, in front of the scenes, whatever you want to ask. Oh, we already have one? Oh, okay.
Is that the top end, the question of
Yeah.
the day? That's what we go to next. Yeah. So it should be in the chat.
Yeah.
So, and you can see when people are typing. Is anyone typing?
Nobody's. So Shamika says your response rate is impressive, and we're very happy with that.
And on that note, what would you credit that high response rate to if you had to pick two things?
If I had to pick one thing, it would be a woman named Sarah Oliver. Sarah Oliver was married to a physician in the community and very connected to the Catholic Church. So what we did was we paid Sarah Oliver, I don't even remember what it paid her, on the side, and we charged her with trying to help get that.
Get the paper surveys out and completed from different various organizations. I think she took some to a popular Mexican restaurant, and like I mentioned earlier, the Jiffy Lube was the best spot. So she dropped these surveys off and picked them up once they were completed, and then also utilizing two of the largest employers for the county, the hospital and the school district.
Yeah, our numbers like immediately jumped when we had the two largest employers. And so, yeah, during this time period, it was just, like we're all helping with this to make it, yeah.
Right.
But it was definitely Sarah Oliver, and we weren't getting the numbers we needed. But once we kind of subcontracted with Sarah and her network, it it was it worked.
It worked.
Mm-hmm.
So I think too the lesson there is if you're not in the community or from the community, it's finding somebody who's a connector and who knows a lot of people and is willing to go out and ask for things. And I think too setting the goal probably was really helpful too.
Right,
So it wasn't just nebulous, like oh we need as many because then you don't know when you're done.
Right.
So
And you may ask, how did I come up with 1,000? There are about 63,000 people in Kershaw County, and I just said, oh, let's do 1,000. So there was no scientific reason we did 1,000. I just thought that was something that we could achieve. Yeah. And the nice thing about SurveyMonkey, I'm sure most of you use it, but it was easy to keep track of where our numbers were at all times, to keep people updated.
And when Sarah collected the paper versions, she then manually entered the data into SurveyMonkey, so it was all in the same space.
Wow. What was the geographic distribution of the surveys? Like, did you ask like zip code or like how did you? So how is it spread? I'm sorry.
Yeah. So the majority were in Camden and Woodlawn, but we did get comparable representation in the other zip codes.
Areas.
And so we even tracked that when we got surveys in. I would say, Sarah, we need more people from the Bethune community.
Right.
So we were trying to make sure that we got not equal representation because the density is mainly in one part of the county, but we worked to get that. So it was pretty distributed.
And there weren't really any differences in the responses based on where they were living in the county.
Which is interesting. Yeah.
So it looks like we do have one question from Lillian. She says, once the data is submitted or presented to the community and stakeholders, who is responsible for the next step of getting the community improvement plan started? Did you make specific recommendations based on the results and findings?
Oh, great question there, Lillian. So our scope of work was only for the needs assessment. And I would love to say that we could have kept moving, but I think the key is whatever you outline in your scope of services or subcontract. And so I think ideally you would want both pieces because then I also thought about like this tarnishing our reputation. We did great work, but we're not there.
Board is sitting on this information.
Right. But we did make recommendations, and I've even given them like a single one-pager that's different than the executive summary to kind of map out how similar the responses were to try to guide them and helping that. But at the end of the day, Lillian, it's their call. And so that part for us for this was just
it's frustrating.
Yeah, so I don't know if our experience is typical or not, but it is what it is for this one.
Well, I think maybe it's not typical in that they kind of only wanted this one part, and so they hadn't thought about like
they hadn't thought
what they would do with it. So I mean, people, and that's not uncommon. People are all kind of interested in collecting data, but then they don't want to do the hard work. Of what do we do afterwards? So I mean, that's not unusual.
Right.
I mean, even if you'd have been sitting in the health department in Kershaw County, that's not an unusual. Getting people through that next step. That's why it's good, like you said, if you have like this start to finish plan, and this is where part. Yeah.
And I think that's common, and just I know y'all are in a class for community assessment, but Catherine and I know a lot of community work is. I find that a lot of communities are very motivated to improve in certain areas, whether it's childhood obesity or they want to improve their infrastructure, and they have lots of ideas. So when it comes to focus groups and different meetings, the ideas are plenty. The part that sometimes the communities struggle with is this thing called execution.
Right.
And so I think that's where it's great as master's students and doctoral students is they just need someone to kind of be their Jiminy Cricket to let them know, like, hey, here's some pointers. And I think it's almost like shrinking the change. Hey, you've got all this data, but the top priorities were this. What are some key actions, or what are catalytic actions that could happen to get you where you need to be? Kind of just get them to kind of go smaller and then help them do that.
Yeah.
So that part, that execution thing is difficult, probably on multiple levels.
Yeah. Yeah. Good question, though. Really good question.